going to talk about how to treat smaller cuts, maybe not be life-threatening, but you don't want a nasty scar, and you definitely don't want it to get infected. Stay tuned. So last week we talked about how to treat life-threatening bleeding. Let's recap that for a second. So we talked about how to use a tourniquet and when to use a tourniquet. Arterial bleeding, that high pressure bleeding, that tourniquet's going to go around the injury and it's going to cut off the blood flow to it and save the person's life. You can also put direct pressure on it. We talked about using just your gloved hand or using some sort of padding like a sterile 4x4 or even a pressure dressing to put that pressure on the wound and let the body naturally form a blood clot and start the healing process that way. We also briefly talked about packing wounds, and we also talked about stop the bleed classes and things where you can learn this in a hands-on environment. I know that was a bit of a longer class last week, so today's going to be much shorter. And I want to talk about what to do for something that's not life-threatening, something that, you're in camp and you cut your finger open on a knife, or you get a paper cut, or you fall down and scrape up your leg or something on gravel. So what do? Well, the first thing is the same. Put the pressure on it to get the bleeding to stop. Probably not going to bleed out from a paper cut on your finger, but nobody wants to get blood everywhere. Unless you're wearing a red shirt like this, it's going to stain. It's going to cause problems like that. So put pressure on it. Try to get that bleeding to stop. It can take a while, sometimes 10 or 15 minutes of just holding pressure on it. That's going to help. It's also going to help minimize bruising there, because bruising is just some blood that's caught underneath the skin. So got pressure on it. You can do something simple like put a Band-Aid on it. Or if it's a bigger cut, you can use super glue or medical glue to hold it together. A physician friend of mine told me that super glue is the same exact stuff as medical glue. It's just not manufactured to the same standards as medical glue. So it's not, the factories maybe aren't necessarily as clean. So take that with a grain of salt, but it's the same stuff. It works the exact same way. So if you're comfortable with that, super glue might be a pretty good option. So you're probably saying, Joe, I don't really want to have a nasty scar all over my finger. Can't use my fingerprint sensor or something like that. This may not help with the fingerprint sensor, but anybody that's ever, hunters that have skinned an animal like a deer, or even if you've ever gotten a cut, you know this. The skin pulls apart. There's tension on skin. And so if you get a cut and you look down and the edges have kind of pulled apart like that, well, that's because all of the muscles and everything else that attaches underneath the skin puts a little bit of pressure on it. Not a lot, not going to tear the skin open on its own, but if there is a cut in it, it's going to start pulling it apart. So in order to minimize the scarring, we want to push those edges back together and hold them there so that it can fill in a smaller gap versus a bigger gap like this. And that's when you get bigger scars. Anytime you cut yourself, there's going to be some scar tissue that forms, and you're probably going to have a small scar. But to minimize that, we want to bring those edges close together and keep them there so the body only has to fill in a smaller spot. So in order to do that, you can use a Band-Aid and pull the skin together and kind of wrap it like that to hold it. May not work all the time. Glue is something that they use. In the hospital, they'll use medical glue. They'll use sutures, which are stitches, or they can use staples. And all that does is just hold that skin together. So what you could easily do is put some glue on it. What you want to do is kind of pull the skin together, and there's a couple different ways to do that. And then you put the glue over top to hold it in place. Hold it, make sure you keep the tension to keep it together until that glue dries, and then leave the glue on until it naturally falls off on its own. If you start picking at it, try to pull it off. I know it's hard, but leave it on there until it falls off, and that way the skin is healed as best as it can. There are also some medical devices you can buy. One thing is called a Steri-Strip. A tip for this is to put one on each side. So you could put one up here and one over here. And then you kind of take and grab both of them, pull them across, and then stick them down. And that helps to pull the edges together and hold it in place. These are sometimes hard to do, so it's definitely easier if you have somebody else put this on. Instead of trying to pull it with one hand or whatever, use both hands, and it helps that way. But definitely you want to make sure that you get those edges nice and tight together like that. I'm going to say this a lot so you remember this. Keep it together, and so your body only has to fill in a much smaller gap when it's going through its wound healing process. That's how to try to minimize getting a scar and how to close up the bleeding. That'll help stop bleeding and everything like that. But what do we do so we don't get an infection in the meantime? Well, the best thing you can do is to keep it clean. Clean it out using just soap and water. I know a lot of people want to put like isopropyl alcohol or iodine or something like that into the wound to clean it. And yes, it will clean it and kill any pathogens that are in there. but it also is going to hurt the tissue, your own skin tissue around it, and it's going to take a lot longer to heal. So we don't want to put anything like that in there. Soap and water is the best thing you can do for it. Once you get it cleaned out, you can use the things we just talked about to get the wound closed up. And then you want to make sure you keep it covered. You want to, especially if you're out on the trail, try not to get dirt and grease and all the nasty stuff out there into your wound. So if you have to wrap it up with something to keep it even waterproof, would probably be a good idea. And just make sure you keep it as clean as possible. You don't really need to air it out. That's kind of a wives' tale. Keep it covered, keep it clean. If you want to put some Neosporin or something like that on, it might help. It's kind of conflicting ideas there, but keep an eye on it. What you're going to be looking for to see if there's an infection, if it looks really swollen and it wasn't like that, if it feels warm to the touch, there's going to be a little bit of a red border around it. But if your whole, if you had a cut on your finger and your whole finger starting to turn red, that's something to be worried about. So just keep an eye on it and look for changes in every day to day. If it was looking one day on the first day and then a couple days later, it looks totally different. If it's got, pus coming out of it or green, reddish, whatever nasty stuff, definitely time to go get that checked out. Hopefully this was helpful. It's definitely not as crazy in depth as last week, but definitely something you're probably more likely to come across. I know it seems like almost every time I'm using a knife, I cut myself. Maybe I should work on my knife skills. Always cut away from yourself so that if you're cutting, whatever it goes to hit isn't going like into your chest or something I got to work on remembering. So hopefully this is helpful for you. Remember, it's pretty simple. A lot of times the simple stuff is the easiest and the best for it. So make sure you get it cleaned out, just nice soap and water. Get the edges pulled back together so it heals nicely, and keep an eye on it. Make sure it doesn't get full of dirt or anything like that, and make sure you don't see any signs of infection. If this was helpful, I would be very appreciative if you'd leave a like on the video. Comment down below if there's something that you want to see coming up, and make sure you hit that subscribe button and the little notification bell. That way you'll get notified anytime I put out a new video so you don't miss anything. Get out there and explore, but make sure you're prepared for any situation that comes at you. Thanks for watching.